Good morning, YouTube. Good morning, team. Welcome to the PT on Ice Daily Show. My name is Julie. I am a member of the Older Adult Division, and I am excited to talk to you all this morning. This topic this morning is going to be a reframe and reflection. Reframe and reflection. And the reframe that I would love to offer you all this morning is reframing our perceived value regarding our journey of caring for older adults. Reframing our perceived value when it comes to our journey of caring for older adults. And more specifically, I would love to offer a reframe and rethink on focusing on who you become in this journey, not on what your patient's outcome is. Focusing on who we become throughout our journey caring for older adults, not what our patient's outcome is. So let's dive in. So first and foremost, what have I experienced, what I know to be true over the past almost 10 years of being a clinician is this, that many, and I would go as far as to say most of the older adults that we work with as clinicians are not going to make it to fitness. They are not going to adopt fitness as part of a major lifestyle change. Practically, they may never make it inside a fitness facility. And I will say that I am coming from a perspective of the fact that as a clinician, I have worked with more acute populations, so acute care, inpatient rehab, and home health folks. Okay. But that's what I believe. The majority of the older adults we work with are not going to make it to fitness. Now, do I believe it's possible for any older adult, regardless of age and complexity and situation, to adopt fitness and change their lifestyle? Could any older adult do it? Yes. Is it more likely that an older adult, if they are surrounded by clinicians who are version 2.0, who are fitness forward, manually skilled, and psychologically informed? Hell yeah, absolutely. But is it anywhere near guaranteed that even if we deliver absolute excellence in all of those realms, that our patient is going to adopt fitness? Absolutely not. Does this mean that you phone it in and can revert to underdose exercise because it all just doesn't matter? Hell no. And let me be very clear here. We absolutely have a responsibility to shore up our skills and become the most excellent version of a clinician that we can so that we can have the opportunity to influence our patient's outcome. That is still our responsibility. However, the reframe is this. We we can't attach our value, the way we perceive our value as a clinician, to our patient's outcome. It's not this one-to-one equation. It doesn't work like that. We can't say, I am successful, I am a skilled, um, excellent therapist if they reach fitness, nor can we say, I'm a failure and I'm not a good therapist if they don't make it to fitness, if they don't do their HEP, if they don't change their lifestyle. It doesn't work like that. I think we're in a lot of trouble. Well, we are in a lot of trouble because I attach my value to this for many, many, many years. I attach my value as a clinician to whether my patient did the thing I want, change their lifestyle, adopted fitness, etc. That is an incredibly fragile thing to attach your value to. If we attach our value directly to our patient's outcome, we are going to be disappointed constantly throughout our careers. We're probably going to hit burnout very quickly. We have to realize that humans are so incredibly complex. Lifestyle change is incredibly hard, especially for older adults who have so many complexities on board. They have multimorbidity, they have aging physiology changes, psychosocial factors, chronic disease, genetics. I mean, we could give them every clinician version 2.0 tool that we have. We could shower them with absolute excellence, and we still don't achieve that desired outcome. So we have to start detaching from that. And I would encourage you all to stop focusing and attaching your value to whether you change someone's mind, whether they do the thing we want them to do. If we think about it, my God, we spend so much time trying to get people to do what we want them to do. I think about this in our relationships. We want our partners and our spouses to act a certain way, to treat us a certain way. We try to do that in our workplace. I mean, we spend so much time trying to get people to do what we want them to do. And some of that is time well spent. But in our careers, working with older adults, I don't think it's a good use of your time to focus on that. It will lead to burnout quickly. Instead of that focus, I would encourage you all to focus and perceive your value on who you become in the journey when working with older adults. Why? Because the skills you develop and the person you become, that is something nobody can take away from you. That is something, regardless if your patient has a positive outcome or a negative outcome, that you can hold on to, that you can hold on to for the rest of your life. It doesn't change. It's not fragile. When you focus on who is the person that you're becoming throughout this journey in your career, instead of thinking, my purpose is to get this patient to do what I want them to do and do that HEP and do their exercises and et cetera, et cetera. Instead, focus on, I am here to meet this person exactly where they're at. I am here to offer a new perspective, a new way of life, new behaviors. I am here to offer inspiration. I am here to offer hope and strength. And when I think about it like that, it takes so much pressure off of me as a clinician. I didn't start thinking this way until many, many years into my career. And when I sit down now and I reflect on who have I become in these past 10 years, this is when I start to realize that, my God, these things are what my value is, right? So I think, the obvious is I have become a clinician and an individual who can scale exercise for anyone who is in acute care in the ICU, all the way to someone who is a higher level athlete. Nothing scares me. I can scale for anybody. I can creatively load them I can do it all. But beyond that, that's the obvious one when it comes to skill. Beyond that, who am I becoming? I am becoming a clinician and a human who is dynamically empathetic, who understands empathy versus sympathy. I have become an active listener. I have become an inspirational communicator. I have become an excellent teammate. I have become an excellent collaborator. I have realized and internalized that my agenda working with my patients isn't the center of the universe. I have become a fierce, fierce advocate. I know how to respond in an emergency. I have become reliable. I have learned after working with so many different types of humans. If you work in acute care, inpatient settings, you just meet everyone and all types of people. I mean, I have become someone who completely holds judgment and can be incredibly open-minded. I've become someone who can make an individual feel seen and heard and understood in the most challenging and vulnerable times in their life. Those are skills that I have learned, that I have improved on, that have challenged me, that I have developed over years and years and years, and I can hold on to those skills for the rest of my life. These are skills that are going to improve the relationships with my friends and my family. I can ground myself in those skills. That is the person I am becoming. And I become that person whether my patient has the outcome that I want them to have or not. So focus on becoming. And when I reflect back and I think about moments of success, like truly when I'm towards the end of my life and I reflect back on my career as a clinician, I'm going to remember moments of success that don't necessarily look like getting my patient to do what I want them to do, their HEP or lift a heavy weight. Yes, those have been moments of success, but those are so much more few and far between than other moments of just bringing someone joy. Like I will never forget dancing with a patient who was stuck in their room during COVID, completely depressed, hasn't smiled in weeks, and dancing with her in her hospital room. I will never forget learning how to hold space for patients' grief when they find out a devastating cancer diagnosis and they have a few months to live, even when that grief triggers my own and things in my own life. I will never forget holding the hand of a family member who is watching their loved one slip away in the ICU. Those moments of just meeting a patient where they're at and offering hope and inspiration and strength and joy are going to be the most important things that I remember, I believe, at the end of my life when I reflect on my career. Becoming someone who can do all of those things and be that type of person for my spouse and my family and my friends, like that's what's going to be incredibly important. And those are the things that I want to focus on and hold value to. And I believe a lot of you will relate to this because I think this concept and this reframe really hits home when you have a family member or a loved one who you have thrown every single tool at to attempt to get them to adopt a fitness forward lifestyle or any version of health. And that has been unsuccessful. And it's frustrating as all hell. I am living this with my own mom right now. She is an incredibly unhealthy individual, has always been smoking and drinking and taking pills has been a part of her life for her entire life. And many of you may relate and you think, my God, I am a clinician. I am somebody who can bring so much value and I can help turn this person's life around. I have all the resources they need. I love them so much, and I can't change their lifestyle. And it's devastating. And for so many years, I remember coming home from college and sitting on the edge of my mom's bed and crying and just saying, "Mom, like you're not going to be around if you don't take care of yourself. Like I want you to be here. I want you to see me get married. I want you to see me have a child. I want you to be a grandma." No amount of that stuff changed her lifestyle, even to this very day. And I just have gotten so frustrated, and I lead with a lot of frustration and anger with her. And, you know, I've had a friend who lost her father very suddenly, also had a strained relationship, and she just, said to me, "Julie, try and remember to just meet them where they're at and just be loving and be kind, because we're not going to change who they are. We're not going to change their lifestyle. And I don't want at the very end of my mother's life, or I wouldn't want that of my patients' lives, to think like this person just was frustrated and irritated and angry with me constantly." Those are not the memories I want people to have of me, right? I don't want that to be my mom's memory at the very end of her life, that, my daughter just was frustrated with me and irritated and told me I needed to be a better version of myself, right? It's not my responsibility to change who she is. I think a better focus is meeting her where she's at and offering love, offering kindness, offering understanding, letting her be who she is, and trying to offer these last memories of what are probably going to be the end of her life to be ones where she feels that I gave her patience, grace, joy, hope. That's what I want to focus on. And that's how I would encourage you all to go forward with your patients as well. So many times, so many of you, I'm sure, who have worked in acute settings, your patients may pass away days after you see them, days after you see them. And I hope that you all focus on, you know what? I want to make these potential last days. Life is so fragile. I want to make those potential last days offer these memories that this patient, if they think about you at the very end, they can say, "Man, that my patients call me my trainer lady. That trainer lady was kind and gave me joy and made me laugh." That's what I encourage you all to focus on. All right, team. I know that was a deep one, deep reflection, and a big reframe. Start thinking about this. Focus on who is the person that you are becoming in the journey of serving older adults, not on your patient's outcome. All right, team. Last but not least here, last. Let me just hurry up and give you what is coming up in the older adult division. We've got courses, our live courses. First off, we are in Michigan, California, New York, and Florida coming up. And then our online courses start this week. So today is the last day to sign up for L1. Okay, so there are tickets still available, but they're close to being sold out. So if you're thinking about it and on the edge, make sure you get into that course. And then L2 is already sold out, which is amazing. So you're going to have to wait until the new year to sign up for L2 if you're interested in that course. ptnice.com is where all that info lives. Have a wonderful rest of your Wednesday.